All right. Hello, everyone. Good evening, good afternoon to all those joining. My name is Dylan Rivera. I am the Senior Digital Marketing Manager at Airlays. And from all of us at Airlays, as well as in partnership with Illuminae MD, we want to thank you all for joining us today for our special presentation where we will be focusing on the regenerative conversation, 2 modalities, 1 goal. We'll really be diving into the evolution of combination therapies and long-term skin health. So a few things we want to call out before we get started. This is a recorded session. So everyone that is attending live, as well as who have registered for the event, we will be sending out the recording tomorrow morning to everyone there, and the recording will be available across Illuminae MD, as well as Airlays on demand. We do encourage everyone to write in the chat throughout the presentation to even get started. Let us know where you're tuning in from. We love to see sort of where you all are joining us. As well as we do have a Q&A section located right next to the chat box. So please put any and all questions in the Q&A area, and we will hold 10 to 15 minutes at the end of the presentation to answer everyone's question if appropriate. So with all that down, we have an awesome presentation. Let's go ahead and bring out our featured speakers, Dr. Mark Capel and Jessica Cooper, Head of Clinical Content Development at Illuminae MD.
Hi.
All right.
Hello.
Jessica, Dr. Capel, hello, how you doing? Welcome.
Doing great. Thanks.
Oh, thank you guys for taking the time to join us today and share all of your insights. We got people starting to come in, looks like from all around the country, outside of the country. So we have Ontario, North Carolina, Texas. Everyone continue to write in. Let us know where you're tuning in from. British Columbia. That's awesome. So today we do have a shorter time frame than we normally do too. So I want to ensure that we get through the entire presentation as well as answer everyone's question. So we're going to jump right into it. Everyone, please continue to write in the chat, put all those questions in the Q&A area, and we'll get all those answered. So with that down, let's get started. All right. So like I mentioned earlier, where we're going to go. Our today's topic is the regenerative conversation, 2 modalities, 1 goal, where we'll be highlighting the technology and the technology behind Airlays, as well as all the insights behind Illuminae MD, specifically the Jesner peels. So with that, we have our featured speakers, Dr. Mark Capel, who we just met. So, Dr. Capel is double board certified dermatologist and founder, medical director of Dermagnify in Point Verde Beach, Florida. So he's dual trained medical degree from Penn State College with the College of Medicine with Alpha Omega Alpha honors. His dermatology residence is at Mayo Clinic, Jacksonville. He was a prior Mayo Clinic faculty member of 9 years, staff physician, including leadership roles in the residency education. He is a published investigator, author of more than 45 peer-reviewed publications, clinical research presented at the national and international dermatology conferences, as well as a diagnostic first practice. So he has dual expertise in clinical dermatology and dermapathology. Sorry about that. Informs on a precision first approach across medical, surgical, and aesthetic skin health. So again, Dr. Capel, thank you for joining us this evening.
Thank you.
Our other featured guest is Jessica Cooper, who's the Head of Clinical Content Development of North America at Illuminae MD. She leads clinical education, scientific content, and professional training for skincare professionals. So she has 2 decades of experience in aesthetics, more than 21 years across clinical practice, sales, education, events, and leadership. She's licensed and certified in aesthetic professions and certified meeting professional, CMP. So as translator of science, specializes in turning complex science, skin science, and clinical research into practical evidence-based education that works at the treatment bed. She's a curriculum architect. She's shaped Illuminae MD's educational strategy through academy curriculum, clinical resources, professional training, webinars, and communication of clinical study findings. So, Jessica, thank you for joining us and sharing. So with that, thank you both. Let's get started with the presentation, and I'll hang out in the background.
Thank you so much. All right, so we do have some surprise swag giveaway. 2 webinar attendees will win 2 Illuminae MD branded items, and also 2 webinar attendees will win 2 Airlays branded items. Now, in order to qualify, you have to stay on for the entirety of the webinar. These winners will be selected at random draw, and Dylan and myself will be contacting the winners. I'll contact the Lumia MD winners. Dylan will contact the Airlays winners, and we will notify you by 5 p.m. tomorrow, August 6th. Don't forget to check your spam, your junk folder between now and 5 p.m. tomorrow, just in case we end up there. I don't want you to miss out on winning something. All right, I'm going to start with talking to you a little bit about the regenerative movement. So before we dive into technologies, let's talk about the concept that's really changing the way we think about skin health. When people hear the word regenerative, they often think of just one device or one ingredient. But regenerative aesthetics is really, it's much bigger than that. It's really a philosophy of care where we're taking complementary treatments and evidence-based skincare just to really maximize those clinical outcomes and ultimately support that long-term tissue resilience. And it really starts with preparation. Great outcomes are going to begin with the before the actual procedure itself. So when we optimize the skin barrier, reduce inflammation, and get patients on like the right home care regimen, we're going to create an ideal environment for the actual treatment itself. When we move on to treatment, rather than expecting one device or a procedure to do absolutely everything under the sun, regenerative aesthetics is about combining complementary modalities. Each treatment is going to bring its own strengths, but when we put them together, this can produce better outcomes more than just one treatment alone. And then finally, recover. Recovery isn't just about downtime. It's an important part of the treatment itself. It's supporting the skin after a procedure. It's going to help maintain that barrier function and reduce oxidative stress. Ultimately, this is going to promote healthier and more resilient skin over time. So the key takeaway here is better outcomes don't really begin when the treatment starts, and they don't end when the patient leaves your office. It's actually going to begin before the treatment and continue well beyond the procedure. And that's exactly the mindset that we're going to use as we look at how Airlays Neo and Illumia MD chemical peels and strategic homework all work together. Dr. Kappel, I wanted to pause here and ask you, I know that you attend a lot of conferences and you have an idea of like really what's going on in our industry. I'd love to hear your thoughts and insight on this whole regenerative movement and the difference between that and this longevity term.
Well, I think that is certainly the movement, regenerative, longevity. I view that as similar in terms of the concept, where it's not just about aesthetics anymore. It's about taking what a patient already has, for example, their own fibroblasts, and what can you do to stimulate them to regenerate, collagen production. And in doing so, with a comprehensive approach that you've outlined here, preparing the skin, treating the skin, recovering, that promotes the whole longevity concept in terms of skin health.
Nice. Well said. Thank you so much. All right, moving on to the modern day patient. Now, before I dive into anything else, it's important to recognize how today's patients, it's honestly changed. Patients are arriving with more compromised skin barriers than ever before. I don't know if anyone in the chat wants to chime in to see if this is ringing a bell, but they're arriving with more compromised skin barriers. And ultimately, this can limit treatment options and delay results that they're actually hoping for, depending on how they show up that day. At the same time, social media has created a more informed, but not always better informed patient. Many come in expecting dramatic results without fully understanding the importance of preparation, consistency, and long-term skin health. And that's why our role as providers have evolved. It's no longer just about performing a treatment. It's about educating patients, setting realistic expectations. That's super important. And ultimately guiding them through this comprehensive treatment journey. And this greater awareness has created greater expectations, not always a greater understanding, unfortunately. So yeah, that's a little bit on the modern day patient. I'm curious if anyone in the chat has recognized this patient. Dr. Capel, I'm going to hand it back over to you here.
Yeah. I certainly have. The modern day patient, it's sort of information overload. There's so many skincare options, so many treatment options, a lot of DIY, do it yourself. And that's what leads to the issues with the skin barrier. I've gotten in the habit of trying to have patients bring in all their products. And I'm always surprised, even with people who you might not think are aesthetically inclined, they have lots of skincare products. And sorting through all that's very important. And part of our job as providers is to sort of focus, redirect, simplify, and make it into a plan that makes sense. In terms of picking treatments and sort of the focus of this presentation, so combination therapy is really in right now, and it is important to understand the concepts, and it makes sense why it's popular. So, for example, we're talking about Aerolase Neo, which is a 1064 laser, and it does a great job at targeting the dermis. It does some surface change, but it really hits that dermal layer. On the other hand, a superficial chemical peel, like those that Illumia MD offer, a Jesner type peel, targets that surface layer. And so when you combine therapies, as long as you do it kind of in the right order and sequence, it really can enhance the results, and it's also safer. So, for example, some of the more aggressive lasers or peels that will treat the epidermis and the dermis, well, that also makes it a bit more risky. But certainly, if done well, you can do those well. But by combining treatments, you're able to get both dermal rejuvenation and epidermal rejuvenation in a safe way, and also a quicker result that the patients can visibly see. So that's the advantage of doing combination therapy. We talked a little bit about what regenerative actually means, and supporting, stimulating the skin's own repair and renewal mechanisms. And so that's very appealing. People would sort of want to do what's natural. And the way I frame it is, we're taking what you already have and we're trying to stimulate the fibroblasts. And I often use the analogy, it's somewhat like a workout. So, if you have good nutrition alone, you're not going to get in shape, but you need to go to the gym or go running. If you just exercise with bad nutrition, your gains are going to be limited. So by combining a good skincare regimen, which is kind of like nutrition, if you will, and in-office treatments, which are the workouts, if you will, you can really get actual regeneration. You're providing the right substrates to the patient and then stimulating those cells to rejuvenate. Oops. So the regenerative cascade, so when we want to think about what is the right order of focus, number one, when we're doing treatments and in that initial consult, we want to look at the patient's skin barrier and make sure it's optimized before you venture into doing some of these treatments. then looking at the epidermis, that kind of aligns with the barrier. Thirdly, inflammation. So if there's underlying inflammation, whether it be acne, rosacea, even melasma is thought to be inflammatory these days, we want to get that under control before we try to stimulate those fibroblasts. And once we take care of those first three steps, then we can focus on those treatments that target the dermis, stimulate the fibroblasts, which then in turn leads to a cycle of controlled damage and renewal, controlled damage, renewal, and that in turn leads to more resilience and long-term skin health. So again, I alluded to this. We're going to be covering the chemical peels with the Lumiere MD. They have a nice Jesner peel, which targets the epidermis, pigmentation, exfoliation, tone, texture, whereas the Aerolase Neo really excels at getting that dermal layer. So when used together, we have the opportunity to give both a dermal and epidermal treatment with quicker and longer lasting results.
Thank you, Dr. Kappel. It's very well said. If peels and lasers have different roles, then the common problem that they're both trying to solve, it's not just wrinkles, it's not just pigmentation, like those are the visible signs, but beneath the surface is a shared biological process that's influencing many of today's patient skin concerns. And this is what Illumia MD has coined oxidative aging. So oxidative aging is a representation of a vicious cycle where you have oxidative stress and constant mild grade inflammation. And this is going to impair mitochondrial function. It's going to deplete cellular energy and ultimately is going to compromise repair of the skin. And that outcome of oxidative aging is the modern day patient phenotype. And this is marked by heightened inflammation and sensitivity, a weakened skin barrier, reduced resilience, maybe less tolerant for treatments. A lot of times we'll see uneven pigmentation and accelerated visible signs of aging. And this ends up in that vicious cycle of continued damage. So ultimately, this is what oxidative aging is. It's those negative exposomal inputs. I'll explain in a moment what that means. This leads to the oxidative stress via those free radicals. We see this inflammatory cascade, that mitochondrial dysfunction, loss of cellular vitality, and that is that modern day phenotype. For those that have access to the chat right now, I would love to hear your thoughts if you want to chime in on, have you seen this? Are you seeing these patients show up where you're like, wait a minute, what is going on? They were fine last time we were here, now the skin's this thin, it's reactive, like it's unpredictable. Curious to see if you've been seeing that more in practice. Now, I mentioned the modern skin phenotype. This isn't just different skin, it's harder skin to treat. These patients aren't presenting with the same skin that we treated 10, 20 years ago. We're seeing a new phenotype emerge, that thinner, duller, more reactive skin I mentioned. It's aging faster, and it's doing it faster than the body can actually repair it. And this isn't coincidence. It's that biological result of chronic negative exposomal stress. Again, I'll explain what that is in a moment. And it's just overwhelming the skin's natural repair mechanisms. And this changes, honestly, everything about how we treat the skin. It's just for those who don't understand it, the exposomal input is basically like cumulative exposure of everything you're exposed to. And again, I'll dive into that a bit more in a moment. Now, because of this new modern phenotype that we're seeing, we need to keep in mind that correction should come after this defense first period of time. Correction will work better when the skin is healthy. So let's say a patient comes in and they're wanting correction. Maybe it's for discoloration. It could be for laxity. we could correct first and jump like right into treating discoloration and laxity. But if the skin is already inflamed or sensitized, patients may not tolerate the intensity or the frequency of the treatment plan you're trying to do with that patient. And ultimately, that's going to be needed to reach their goals. When that barrier is impaired, or the skin is going to be prone to increased transepidermal water loss or TOOL. They'll have a heightened sensitivity to the treatments, and this can limit those treatment outcomes. Environmental exposures like air pollution or particulate matter can also contribute to barrier disruption and also increase that transepidermal water loss. And this is done through oxidative mechanisms. And this is really why the industry is switching to a defense first mindset versus jumping right into correction. Before we push this aggressive correction, we have to evaluate the triggers that keep that skin in an inflamed reactive state. And these would be things like UV exposure, pollution, overexfoliation, underlying inflammatory skin disorders or conditions, and inadequate post-procedure care. So keep in mind, if that skin barrier is compromised, in addition to TOOL and sensitivity, we can expect to see greater vulnerability to oxidative stress pathways, potential for pollutants to penetrate the skin more rapidly. And this could be done through follicles, sweat glands. And when we look at discoloration, inflammation is a major driver of post-inflammatory hyperpigmentation. Not only can this inflammation increase melanin production, it can also alter pigment distribution. Now, when you look at like textural damage and aging skin, UV and oxidative stress can activate these like matrix degrading enzymes known as MMPs. And that contributes to the breakdown of collagen, elastin, support structures. And one of the reasons is this chronic inflammation and oxidative stress, again, what we call oxidative aging. This really can undermine your rejuvenation efforts that you're doing in clinic. When we look at inflammatory disorders such as blemish-prone skin or redness-prone skin, barrier impairment and inflammation are pretty much, it's just common, it's inevitable, it's going to be there. So prioritizing barrier support, reducing inflammation can improve comfort. It can set the stage for more effective correction, kind of getting through the storm before we clean up the mess that the storm caused. So this is just a nice little process or pathway to just consider when someone is wanting you to jump right into those correction efforts. Like, think about these inflammatory disorders first. Let's reduce the inflammation. This is the no skipping zone, and then we can go right into correction. Now, I've mentioned the exosome and the I've mentioned exposome, which is different than an exosome. And I know that can be a little bit confusing. So I wanted to pause here because I don't want to assume everyone attending the webinar today understands the difference, or maybe you thought I was misspeaking when I said exposome. An exosome is going to be a biologic messenger. It's produced inside of the body. It's influenced by inflammation, tissue repair, and cellular signaling. So an exosome is something the body actually makes. Now, I was talking about an exposome earlier, exposomal stress. An exposome is external and lifestyle-driven factors. It's not a product. It's not an ingredient. It represents the cumulative exposure over time, and this shapes how skin changes over time. So the exposome isn't something the body produces like an exosome. It's the total sum of exposures that the body experiences over a lifetime. So think of this kind of like a blueprint for how your skin is actually presenting itself. Now, to bring this patient journey to life, Dr. Capel and I are going to walk through this together. I'm going to focus on the role of skincare before and after treatment, where Dr. Capel is going to cover what happens in the actual treatment room with Aerolase Neo and the Illumier MD chemical peels. and then I'll jump back into the post-procedure care. So one of the biggest shifts in regenerative aesthetics is moving away from thinking about individual treatments and instead thinking about the entire patient journey. Dr. Kappel touched on that a little bit. Every step will have its own purpose. We're going to begin by preparing the skin to optimize the barrier function and treatment redness. I'll review what Illuminate MD recommends for preconditioning in a few slides, but this step is incredibly valuable and it's often skipped. I think because there's like a rush to get to the finish line. Preconditioning the skin is preparing the skin for treatment, and not just by getting the skin healthy, but it's more preparing the canvas for the artist, you, those who are attending the webinar today. So imagine if you're the artist and you're painting this beautiful portrait on a rigid rock, how that would turn out versus painting it on this smooth, beautiful top piece of canvas. I think your art would turn out quite different. And that's really what preconditioning is doing. So with that first overview, I'd like to hand it back over to you, Dr. Kappel, to discuss the in-office portion of the journey where these complementary modalities play a unique role.
Yeah, and ideally, this doesn't always happen, but ideally, we're doing a consult and we're coming up with this plan 1, 2, 3, 4 ahead of ahead of their treatment appointment. Now, sometimes patients want to come in or they're in a hurry to get something done. So I would caution, being tempted to jump into anything. So, the skincare, both pre and post, is really your insurance policy to, number one, optimize the result, but number two, prevent adverse effects. So very important. On the other hand, I will say Airlace, very safe laser if done correctly. And, you can treat all skin tones. And if you use the right settings, you can make adjustments if their skincare wasn't ideal. But, and this is the ideal scenario, you're coming up with a long-term plan that includes all of this. And when you're kind of even going through your consults and giving your quotes on how much everything's going to cost, you want to come up with a way that it's all sort of packaged together, whether you basically say you've got to get the skincare before we schedule your appointment, or it's somehow packaged in as part of your treatment plan. That is ideal. So assuming they've done good skincare, patient comes in and gets the Airlace treatment. The great thing about Airlace is, you cleanse the skin. It doesn't need any ultrasound gel or anything. It's a no contact laser and a very comfortable treatment. And then after completing it, and remember, it's a 1064 laser, so it's a deeper laser. So you would do that first before you do the peel. And then, but anyhow, after you finish your Airlace, then you can move on to the superficial peel shortly thereafter, and do a peel like you just normally would do a peel, because that's superficial. So in general, when we're combining treatments, you want to treat the first thing is the deeper and work your way up. That's the general concept in any sort of combination therapy. We're doing the deeper treatment first, and then the more superficial treatment last. In general, that's the way you'd want to do it. And then, if you want to, Jessica, take it away from the post-care.
Yeah, absolutely. So we support recovery to help maximize healing and protect that investment, like you were just talking about, Dr. Kappel. I think that's the best way to think of it. It's like an insurance policy. It's really crucial to control the environment post-procedure, or you're leaving your patient to their own devices, and who knows what they have in their drawer of lost hopes and dreams at home, as I like to call it. I think it's best to provide the post-procedure care if possible. And like Dr. Kappel said, maybe like bundling it in, incorporate the costs there as well. Dr. Kappel?
Yeah, so just a little bit about the technology with Airlace Neo. It's one wavelength of as I mentioned, 1064 nanometer. And the unique thing, of course, is the pulse duration that makes it very effective and safe. So it's non-contact, there's no cooling. What's interesting about the Airlays, it uses air cooling, not, in terms of keeping the machine cool, not water cooling. One handpiece, you can change the tip at the end for different spot size, and it can be used on any skin type. It's a small unit, which is fairly portable. So that's another nice, convenient thing about Airlays. So again, 1064, it's the deepest penetrating wavelength. It can go 5 to 7 millimeters in the dermis. It doesn't have much melanin absorption, so it spares the epidermis largely, whereas it will be absorbed by hemoglobin and water in the dermis, and that's why this wavelength works so well and makes it very safe. So again, the unique thing about Airlays versus the others 1064 lasers on the market is the 650 microsecond pulse, which basically was devised because the epidermis, in terms of absorption, is slower than the actual pulse, so it makes it very safe and even at high energies. And therefore, you can treat all skin types. And many, many indications, which is also great. Vascular, pigment, acne, rosacea, rejuvenation, hair reduction, and the list goes on. There's even more, but it is really a very versatile laser, ideal laser in the dermatology setting in particular, where we're dealing with all these things on a day in and day out basis. And again, all skin types, from type 1 to type 6. Of course, you adjust the settings appropriately. They have a great manual in terms of adjusting for what's the indication and the skin type. So it's a really nice platform with really good support in terms of directing the user how to use it appropriately. So what does the NEO do in this regenerative cascade? Well, in particular, it's the middle three things here. So Airlays actually is anti-inflammatory. It's amazing how well it works for acne and other inflammatory conditions. It targets the dermis predominantly, and in doing so, targeting the inflammation, the dermis, the fibroblasts, this is how we get to improved resilience. And again, there's many publications about why the 650 microsecond approach is ideal, including for severe acne. All right, Jessica, take it away.
Thank you, Dr. Capel. So if you are curious who Illuminate MD is, just kind of backtracking a little bit here, we are a physician-dispensed skincare line, and we are rooted in the principles of regenerative skin health. Basically, our approach focuses on supporting the skin's natural ability to repair, renew, and maintain optimal function through evidence-based skincare. And informed by exposomal science. So that's a little bit about who Illuminate MD is. Also want to just take you through a quick overview of our Defense First mindset. This is a nice overview of our retail portfolio. The Core 4 Essentials supports all patients, whether you're putting them on a targeted relief protocol or a regenerative skin health protocol. We also like to use the Core 4 Essentials to precondition the skin for treatment. So I'll touch more on that on the next slide. If we're presented with redness prone or blemish prone skin, we should focus on providing the patient with targeted relief first, reducing that inflammation like we talked about, before we move them on to regenerative skin health protocol that's going to help target discoloration or aging. So again, I told you I was going to talk about that Core 4 Essentials there first, or a little bit more, just because this ultimately is what we like to recommend for preconditioning the skin. So if preconditioning is new to you, we like to use the Core 4 Essentials. This is going to help support that new skin phenotype we talked about. And prep that skin. It's going to defend against the effects of those negative exposomal inputs where we're all exposed to them every single day. We're going to use vitamin C to help protect against the oxidative damage. We'll use retinol, vitamin A, to correct the actual damage itself. We'll use an AGE defense serum to help defend against the advanced stages of aging. And then, of course, your insurance policy with broad spectrum protection, and that's going to prevent the damage from starting in the first place, reduce the inflammation, and also, again, protect those the investment of the in-office treatment. So that's the core 4 essentials. Now, when you look at this before and after photo, this was before the treatment even begun. It was the opportunity to improve the health of the skin. This Illuminate MD 28-day case study is a great example. The patient actually achieved 73% improvement in brown spots just using topical skincare alone. So again, we used a Vizia here. What's important to note, though, with this before and after is that 2 of the core 4 essentials products were used in this trial. That was our Everactive CNE plus peptide and our retinol resurfacing serum at a 0.5% strength. We did use IntelliBright as well because the patient's primary concern was discoloration or uneven pigmentation. So IntelliBright is nice to add in that kind of situation where discoloration is the primary concern, or if post-inflammatory hyperpigmentation is a concern for the patient. So I thought that was a pretty impressive before and after. And just imagine if the patient showed up, Dr. Capel, like with a prepped canvas like that before you even got into the Airlaze Neo treatment and chemical peel. Just imagine the jump start you're getting where you can really maximize that treatment outcome. This as well is part of the same case study where we saw a significant reduction in redness. Again, just showing how much you can improve and prepare that canvas for treatment before actually jumping into the treatment itself. So I thought I could share those with you guys. Now, moving on to our chemical peel portfolio. I'm reviewing 4 today. As Dr. Capel mentioned previously, one of the advantages of the Airlaze Neo is that it opens the door to combining complementary treatments. And within the Illuminate MD professional portfolio, we offer several neutralizable chemical peels that can be selected based on the patient's skin concerns and the treatment goals. Today, I'm going to highlight here our Radiant 30, which is a 30% lactic acid peel, very protectable, very stack friendly. And this one is specifically available globally. So no matter where you're joining from, you will have access to it. The Radiant TXA is available in the UK only. And this chemical peel combines lactic acid with tranexamic acid. And both of these are going to help support patients with pigmentation concerns. So those are the first two peels. Those are neutralizable. That means they're time dependent. You have to neutralize them after a certain amount of time. Moving on to our self-neutralizing chemical peels, both of these are available in North America only. We have Glow and Power Glow. We have a half Jesner formulation with Glow Peel, and this is an excellent option for patients looking to improve skin tone, texture, acne, things like that. For patients with more resilient skin, we can progress to Power Glow. This is a full Jesner formulation, which provides a deeper level of exfoliation and is well suited for concerns such as acne, scarring, and advanced stages of aging, as well as pigmentation. So together, our professional peel portfolio gives practitioners the flexibility to prioritize that treatment selection. And it's based on the patient's skin condition, concerns, and their unique treatment goals. And one point that is worth mentioning is that treatment sequencing. Dr. Capel touched on doing the Neo first, then the chemical peel. This can vary from modality by modality. Here, I really do see the value of doing the Neo first, followed by the chemical peel. When you are looking at stacking treatments, I always want to reiterate that it's always important to base the clinical choose the treatment selection and the stacking based on the patient in front of you, the individual treatment plan. You're always going to defer to the manufacturer you're using and your professional opinion as well. So Dr. Kaplan, again, I know you're a huge fan of Jesner peels in general and the Illumient MD Jesner peels. I know you touched on targeting the dermis first and the outside first, but can you share a little bit more why you love Jesner chemical peels so much?
Well, they've been around for a long time, and there's a rich history of using Jesner peels in dermatology literature. I do like, so one of the issues with the full strength Jesner, which is the one on the right. So if that's sort of the full strength Jesner is, there are some reports of maybe pigmentation occurring. So the fact that you have a half strength, this is allowing it to be a safer superficial peel, less likely to have any issues with pigmentation.
Perfect.
So there's a rich history of Jesner peels, and I think it was smart to have a half strength. And if they do great with the half strength and no issues, why not increase it? It's just this is the concepts we do when you do a series of treatments. We're usually going up in energy, or we're going up in strength of the peel. So that's a nice addition there.
Thank you for adding your insight there. I'll hand it back to you here.
Yeah. So again, just to reiterate, when we're using a superficial chemical peel, this is primarily targeting the epidermis and the skin barrier, whereas when we're using a non-ablative 1064 laser like the Aerolase Neo, this is a primarily dermal rejuvenating laser. And when you use them together, it's a plus, but it's even more than that, because there's a likely synergistic activity occurring when you're stimulating both the epidermis and the dermis on the same day. So you will get additive results quickly and safely if done correctly. Combination therapy, stacking is another term. Everybody wants to be on some sort of stacking protocol now. So, whatever term you use, this definitely it makes sense. But just remember, in general, we're doing the deeper treatment first with a laser, and then moving up more superficial with a peel. I do want to share one case. So this is a patient who had both the Aerolase Neo and a Jesner peel. So the pre is on your left and the post is on the right, and you can see just the increased glow of the skin. The radiance is increased, pigmentation is more even, pore size is lessened, so it's a nice additive result here. And this is a Fitzpatrick type 4 patient, so illustrating that the combination of these two device plus peel can be done in skin of color.
Thank you. That photo is so impressive. And I think you said you used Power Glow on that one, right? Our full Jesner?
Yes. Mm-hmm.
That's absolutely incredible. I'm absolutely loving that combined treatment there, and that it was on a Fitzpatrick 4 as well. Yeah, absolutely beautiful. All right, I want to be mindful of our time. I know we're kind of wrapping up here. I did want to talk briefly about our Hydra Rescue Mask. This would be used after treatment. This is going to help primarily cool and calm the skin. It's very rehydrating as well. The Hydra Rescue is one of my favorite post-procedure products because it's a biocellulose mask. I'll tell you more about that on the next slide. But this is going to give that immediate cooling sensation post-treatment and deliver intense hydration. So we do recommend applying this post-procedure and leave that on for about 10 minutes. Now, what is a biocellulose? If you're not familiar with that term, biocellulose can hold 100 times its weight in dry weight in serum. It's different than a sheet mask where a lot of the solution is left inside the foil package versus being transferred to the skin. The biocellulose, ours is made of like a fermented coconut. And this is going to act like a second skin. And you can actually feel the heat in the mask when you take it off. You can feel that heat pull right out of the skin once you've removed it. So I absolutely love this post-treatment. This is just a nice before and after showing the redness reduction post-treatment. This was actually done after PRP when they applied our Hydro Rescue Biocellulose mask. So big reduction in inflammation in the skin. We did another trial where we actually used a contact thermometer to measure the heat reduction in the skin, saw a nice reduction there in all treatment areas of the skin. This was actually done after microneedling, so across the board, significant improvement, objective and subjective data there showing that it is a huge win after a multitude of procedures.
I just want to interject. I really do.
Go ahead.
I really do. Yeah, I really do like masks these days because we want to simplify post-care, and you can really hardly mess up a mask at home. So it's a great option if it's particular for post-laser, when there's heat residual in the skin. Masks are very helpful in the post-care time.
Absolutely. And that mask that we have is available for professional use and for home as well. So it's really a nice extension of the treatment room. And we're big advocates of post-procedure care. So of course we have a professional size sunscreen. We have post-procedure kits, one with and one without hydrocortisone, depending on your region. And this is just supporting what Dr. Kaplan and I talked about. It's just that insurance policy. It's just protecting the environment post-treatment, protecting your investment, the patient's investment. And again, as Dr. Kaplan said, like you could bundle this or melt this into the price of the procedure, but it should always be a part of that treatment journey. So that is something else that we have at Illumier MD. And as far as what we want to recap for you, Dr. Kaplan, I thought maybe I could take like the first few, and then I'll maybe throw it to you for a few of them. But as we wrap up, we would just like to leave you with 5 key takeaways from today's discussion. First, modern skin is a harder problem to solve than it was years ago. Today's patients are consistently exposed to UV radiation, pollution, stress, all of that stuff. And again, they're influenced quite a bit. We're no longer treating isolated concerns. Honestly, we're treating skin that is under continuous environmental stress. Our second takeaway is that defense comes before correction. It really should. Healthy skin responds better to treatment, prepares the skin beforehand, supports it afterwards. And it isn't an extra step, honestly. It's just part of the treatment plan. And it really plays an important role to achieving these consistent results. Dr. Kaplan, that's going to lead perfectly into our next takeaway. Do you want to take it from there?
Yeah, just to reiterate, I've said it before, but depth is sort of the way we think about combining treatments. And I did want to point out, I do like this distinction here. There was a distinction in number 4 about sequencing rather than stacking. So maybe implying, like, if you think stacking is like you're hitting the same layer with 2 different modalities, maybe don't do that. But sequencing is a nice term because we're moving up. Starting at the deeper layers in the skin and migrating up with the different modalities of treatment. I think that's the concept that we want you to understand when combining treatment.
Nice. Thank you so much. And then finally, regenerative aesthetics is about the entire patient journey when we prepare the skin and we treat it strategically and support recovery. And we're going to protect those results. We're just doing more than improving a procedure. We're ultimately helping patients achieve healthier, more resilient skin over time. And I hope today's discussion has really shown everyone who attended just how thoughtful treatment planning and these complementary modalities can really work together to create a better outcome for both patients and for you within the practice. So should we hand this over. Maybe we should do some Q&A now.
Sure. I see one question. I may have answered it, but it was, can you do the glow or power glow peel after airlays? And the answer is yes. But I think the question was there, the point that the Stephanie was making there, that those are more intense peels than like the lactic peel, which is true. So let's say it's a patient who's never had a peel. Well, why don't you do the least aggressive peel first? I mean, you want patients to kind of sign up for like 3 to 4 of these treatments, and you don't have to use the same peel each time. You could start with the lactic peel and then go to the glow and then the power glow. You can sequence it that way. Again, depending on how they tolerate, making sure that there's no issues with post-inflammatory hyperpigmentation, et cetera. So in general, when we do sort of a peel program, you want to, the very first one, you want it to be maybe a little weaker, which is fine. They're still going to get a result, but just explain that to the patient that we want to make sure your skin does well with this, and then we'll gradually increase the concentration of the peel or the energy of the laser.
Right. I did see a question about are the Illumia MD peels safe for all Fitzpatrick skin types? Are neutralizable peels? Absolutely. Glow peel, yes. With Power Glow, that's up to the provider's discretion. Dr. Capel, you personally have used Power Glow on all Fitzpatrick skin types. Is that correct?
Yeah, I tend to use Fitz 5 and 6. I probably would do the glow. And here's the other thing with peels. It totally depends on technique too. So how hard are you rubbing? How much liquid are you using? So you need to understand proper technique when applying a peel. We want an even layer and the same amount of pressure, and even the applicator that you use. Like if you switch applicators around, one may have more liquid in it than the other. So just try to be consistent with the way you do peels, and you'll end up being more safe.
That's amazing. Yeah, and Dylan, if we want to go back to that one slide with the QR codes, I'll explain what those are. So if you're an Illumia MD partner, or you don't carry either of us, scan the Airlays QR code on the left to schedule a demonstration. If you're interested in partnering with Illumia MD, scan the QR code on the right. And I know both of our companies they have a special promotion going on for you if you're wanting to partner with us, and it's too good to list here on the webinar. So if you are interested in to partner with either of us, then we can share what that special webinar promotion looks like for you. So yeah, if you don't want to scan it now, just take a picture of the screen there, and you can always go back and scan them later. Thank you, Dylan.
Oh. Hey, Dylan, you're muted.
Okay, cool. Thank you both for sharing all of your insights today. I mean, the goal was pretty clear cut. I mean, we want dermal and epidermal rejuvenation, and it all comes down to the right therapies and the right sequence too. So, that does do it for our time today, everyone. We have listed Dr. Capel's and Jessica's information on the screen. So please, if you have any additional questions, please reach out to them directly. They'll be happy to answer everyone's question. If you have anything specific for Airlays, please visit airlays.com or email us at information@airlays.com. Again, one last time, thank you, Dr. Capel. Thank you, Jessica. Lots of good insights here. We'll be sure to share the recording with everyone tomorrow morning, and it will be available on Illumia MD as well as airlays.com as well. So with that, we will see you at our next presentation.
Thank you.
Thank you.
Bye-bye.